Welcome to Health Facts with Normanie Ricks. I am your host, Normanie Ricks. I like to start off each episode with a little known health fact. Did you know that on average, more than one physician commits suicide every day? That's 365 per year. Suicide deaths are 250 to 400% higher among female physicians when compared to females in other professions. That's alarming. Today, I have the honor of having Dr. Pamela Buchanan as a guest on the show. She is an emergency room physician, a Black female doctor, a TEDx speaker, and a mental health advocate. Welcome to the show, Dr. Buchanan.
Thanks, Normandi. Thanks so much for having me. And I appreciate that. I've been learning a lot about suicide because it came knocking at my door. And I even learned the language. I just learned this year, as I've been on the speaking circuit, that people are so sensitive about language, and I respect that. So the language is that like one physician per day dies by suicide, because when we say commit, it's kind of placing blame on the patient, on the victim. And so one physician per day dies by suicide. And I know that most people don't know that, because I didn't know it until I started feeling that way.
Yeah, this really, really, really horrible statistic. So
I know, but the fact that we're talking about it is the light in the tunnel.
So, Dr. Buchanan, can you tell us about strong medicine? What is that?
I'm a physician, and the thing that helped me as I was going through my issues, when I was feeling depressed and like in despair, like nothing could help. Me and my partner, Rodney, we were thinking about what helped me. And what helped me was going to therapy, but what helped me the most was speaking to a physician coach. And so then I became certified as a physician coach and a business coach, because that's what I do. So strong medicine is something I founded to help physicians stay in practice. I also help other healthcare workers, because a peer understands a peer. The gap in care with my therapist, she didn't understand what I was going through. And so some of the suggestions were impractical. The way that doctors work is bananas, because the healthcare system is bananas. Right now, I'm coming off a 24-hour shift. And I was just talking to my guy Rodney, and I was like, it's crazy that we still work in 24-hour shifts, because it takes a lot. And I was like, and I have to really wonder, after about 15, 16 hours, am I truly clear? Am I my best? I got through the night, but that's going to be something I'm going to have to reassess, because I'm always telling people to take care of themselves. I got to practice what I preach.
Yes, yes, yes. So I think that as more people become more aware of mental health, I think a lot of people are talking a little bit more about physician burnout, whereas before, nobody even talked about that. Nobody talked about having a physician coach. Nobody talked about the person, the caretaker, or the person who's taking care of you being tired. So, how are you being an advocate to bring that to the forefront?
So number one, through strong medicine, I teach, I coach, I do courses, and I just give permission, because if it's anything my therapist did that was so helpful, gave me permission to be okay with not being okay. Because I am just a person. Take that superhero cape off. I am not special. I just can read a lot of books and remember a lot of stuff. And I know everybody can do that, but I'm still an individual person, not Superman. And when you realize that, then, you can, you know better, you can do better, like my mom used to say. And as a physician, the way we're trained is crazy, because think about it. If you really think about it, it shouldn't be surprising. When you are a smart person, people are like, oh, you should be a doctor or a lawyer. And you're like, okay, you get faith for that. As I remember, that's how it was when I was coming up. But I kind of came up with my own idea that I wanted to be a doctor. I really admired my pediatrician, the only Black doctor I ever saw. And she's kind of like famous throughout the city. She did a lot of things. So when you are that person, I get A's. I can hardly remember getting B's throughout until I got to college. I remember physics hit me. That was that B.
Mm-hmm.
And you're just a high achiever. You go through medical school. You're competing with people, and you got to be the top 1%. That's what a doctor is, the top 1%, because that's what it takes. And so you defy all these odds. Some people develop a godlike complex. Some people, I feel like I have such reverence for God. So I wouldn't say I had a God-like complex, but I feel like you think you're superhuman, like you can do all the things and then some. And I would for a while. And then when the burnout comes, it crashes like boom. Physician burnout because we're whole people. You got your life as your doctor and your work, and then you got to still home to be a wife, a mother, or whatever it is you are in your personal life.
So you've worked in an emergency room for over 20 years. How has that shaped the way you approach stress, health, and success today?
So my career is like not so typical. So I started off 10 years in private practice, and then my kids, I went through a divorce. So I was trying to figure out, like all mothers do, how can we make work and school and taking care of the kids work? So I began to work at night in the ER. But always been not a fan, and I was proud to say a hustler, because I was in that hustle culture because I was poor. I wasn't even poor because we couldn't afford it. Oh, no, I was poor. And so when I came out of medical school, the song that would play in my head was Every Day I'm Hustling, because I needed to get some money and take care of the things. And I had those student loans like we all did. And I was the primary breadwinner, like so many Black women are. And even though at the time I was married and had 3 children, I got divorced. I had to figure out how am I going to work and take care of these kids. And I wanted to have custody. I didn't want any issues. So I began to work at night in the ER. But before that, I worked basically 2 full-time jobs. On the day I had a private practice. At night, I would go work in the ER sometimes. It was nuts. When I look back at it, I was like, girl, you crazy. So I wasn't taking care of myself. Then working in the ER, I worked a little bit less, but I still brought that same energy of I could pick up an extra shift. I could pick up 2 extra shifts. Oh, let's pick up 8 extra shifts. And so I was working, work. I finally slowed down now. I finally learned.
You often say stress is the signal and purpose is the prescription. What do you mean by that?
What I learned is, so people talk about burnout. They say it all the time. So then what do you do? What am I supposed to do? Just sleep all day? Am I supposed to, we can't do that. We got bills. We have kids to take care of.
Right.
So if I'm burned out, what am I supposed to do? So I've been so interested in this, and I've been doing research because I just want to know more, and I want to be able to help people because I want to be able to reverse engineer how did I become okay?
Mm-hmm.
Because when I tell you the way that I was not okay, I mean, it was, when I think about it and reflect on it, I'm so thankful and blessed to even be talking to you.
Mm-hmm.
Because what was going through my mind was, if anybody knew how to take themselves out of here, it's me.
Mm-hmm.
And you know that you are starting to have a spiral towards a path where burnout is becoming suicidal when you have a plan. That's the key thing, a plan. I was thinking of specific ways, and I won't say because I don't want to give anyone any ideas. I want to be responsible of how I could in my life. I was trying to think of ways of how I could in my life and make it look natural. And I knew how. If anybody knew how, it's me. But burnout is the precursor to that depression, to that suicidality. And so burnout is, I like to think of it as when you just kind of like have nothing to give.
Mm-hmm.
We think about it in the analogy of a flame or a candle, it's snuffed out. And so when you are someone in such a helping profession like a physician, you start off with this fire in your belly. Like, I'm going to save the world. I'm going to be the best doctor ever. I'm going to do this. I'm going to volunteer here. And when you're a Black female like myself, you're like the crown jewel of the community. And people are proud of you. Rightfully so. But then people then start to ask and ask. And you feel an obligation to give. Example being, girl, you should speak at my church. Girl, it would be good if you come speak to the kids at the school. They've never seen a Black doctor. Girl. And people telling you what you should, could, and would do. And you get paid for it. On top of the fact that you are inhuman, which you don't recognize and people don't recognize because they see you as a superstar. And if you like me from the hood, you're that ghetto superstar. So they see you as that. And they're asking you to do all the things, not realizing you are just a woman. And so doing that is what caused my burnout, just trying to do other things. But specifically, what caused it was the way the pandemic was smushed and just compounded, just the concentrated effort of doing so much in such a short period of time. And I speak about it a lot because I feel like people are acting brand new right now, forgetting that that pandemic happened and that was real, saying things like it's a hoax. I'm so sensitive to that. I actually get quite angry because I was there in the middle of it, in the hallways where every room would be full, where we were doing things that was not standard and against policy, considered definitely not sanitary. Like there would be patients in the hallways. There'd be patients in chairs. And then we didn't have enough PPE. I know some friends that they used to reuse the mask and they kind of like get them washed. We had that service for a while. Gross. Gross, like masks that somebody else wore. They said that they autoclaved them, meaning they sterilized them. So long story short, that burnout is just when you can't go any further. And it's a signal. It used to serve a purpose in the primitive world. Let's say you were a settler. It served the purpose because you felt burned out, but you got to get these seeds planted in the ground for the harvest because otherwise everybody's going to die. We do not live in that anymore. And so when your body is telling you, I can go no further, listen, because when we don't, now we have chronic stress. And you have chronic stress that is so dangerous, especially to women. That's why, because chronic stress increases hormone levels that should only be raised when you're in fight or flight. Like, think about if a bear was chasing you. You need your hormone levels of cortisol and adrenaline raised. But on a day-to-day basis, just because your job is stressful and racist or your husband is not a great guy, that can increase those hormones as well. Stress is the signal. It's meaning that when you have that signal that stress is there, listen and do something. Mitigate and manage the stress. Meaning that you have to really say, what can I take off my plate? And that's why I say purpose is the prescription, because when you know what your purpose is, that's the best of what you have to give to others. That's the thing that you're like, okay, this is what I'm supposed to do. When you're a spiritual person like I am, I'm a Christian, you'd be like, this is what I'm called to do. And it fits in a box. It's in a box. And that's your purpose. And then you have to decide if anything is outside of that box, you don't have to do it. You can do it if you want to, but you definitely don't need to.
Yes.
And so that's what purpose being a prescription for burnout. Because once you do that, then you can really say no, which is a whole sentence, and protect your peace.
Yes, yes, yes. I have talked to so many people lately, and as women, I think I've talked to a lot of people when they hit age 40, they learn how to say no. So it's like a switch goes off, and then you learn how to say no and set boundaries and protect your peace. So I started out my career as a home health occupational therapist, and I feel like that set the foundation and taught me a lot, a lot. I saw so many people who were the winners of their family, the strong person in their family, the person that takes care of everybody. I just saw so many of them that had a stroke. And I used to do rehab and go to their house. And that taught me a lot. And it really always is in the back of my mind. Like when my body starts telling me to sit down, to go sit down and rest. So I think that you said a lot there, and I can relate to all those things.
It's not just conjecture, because generally speaking, Black women have been traditionally the backbone of the communities. Mm-hmm. By default, that we wanted to, because a lot of us want our soft girl era, right? But our communities have been decimated by the 1994 crime bill. So a lot of the men are out of the community for things that are now considered frivolous, but those convictions aren't getting overturned. So many of us are single parents, and many of us are taking care of, like, we're in sandwiches. We're taking care of our parents plus taking care of our kids. That's a lot of stress. And that's why I say you have to really sit down with yourself and be honest and define what your barriers are. And you might have to tell mama, no, mom, I can't take you to the grocery store today, but I can do it on Thursday. Let's just make a plan that every Thursday I'll do it. Really do those things. Or tell your kids, you can sign up for soccer, basketball, tennis, and dance. We're not doing all the things. Pick a thing, pick a lane. Yes. And so just practical is what's important if you want to protect your peace and keep from having a stroke.
Yes, I agree. So President Biden passed a bill in 2022 about physician burnout. Can you talk a little bit about that?
Oh, there's a bill called the Lorna Breen Act. And I'm so happy that that is coming to an existence, because what we're doing, I'm actually ambassador for the group. We meet and talk about policy, and we'll do different fundraisers. But That bill is about suicide prevention. So every hospital, every healthcare organization is supposed to have a way to mitigate suicide prevention, a way to decrease suicide. There's a motorcycle going by my house. So we're supposed to be able to, when we have an issue, have somewhere to go. And that's the Lorna Breen Act. Right now, I can say that hospitals are doing it very surface level, and I hope that they commit to it more fully. Mm-hmm. What I mean by that, here's a quick rundown of how my burnout happened. I would work during the pandemic. I never got sick. And I just work. And I've always been a hard worker. They can always depend on me. And the hospital come to know that, oh, if somebody got sick, somebody called off, they can call me. And that was because I was a single parent, had to send my kids to private school because we live in a nice neighborhood that's racist. My kids had issues with racism. So I had to drive 20 minutes away to a school that was more diverse so that they would be okay. Got to pay those tuitions, got to pay for your kids. My son has an autoimmune disorder that insurance won't cover the medication that I know works. They're trying to give me something that doesn't work, so I pay cash. So a lot of responsibility. And I'm working during this pandemic. They were throwing out the cash, like work this extra shift and talk about making 2 to 3 times what you normally would. And so I would. Everybody needs to remember all money ain't good money. In the instance, this wasn't, but I was working 80. I remember one week I clocked 100 hours.
Wow.
And one week. And this pandemic was isolating. I couldn't see my family because I didn't want to be around them because I didn't know if I could give them COVID. You ever been afraid that if you just breathed on your baby, they would die?
Yeah.
So that was an issue. All of that was happening. And then I would hear a voice as I'm driving over the bridge to work saying, jump in, just clear. And I ignored it. I said, I'm probably tired. And then I did the opposite of what I should do. I said, let me pick up more shifts so I can stay busy. Or I bought a Peloton and said, let me start spinning so that I could exercise it out. Praying more on virtual church more. And then it wasn't until a colleague died by suicide during that time period that you would not have ever expected. A person who seemed to have that perfect life. That's when I knew I needed to get some help. It was so very difficult to get help. Very difficult. I have a lot of empathy for people who are not as privileged as me by being a physician who have these issues now. It's made me a better doctor going through that experience. And when I finally got help, it was like air. It was like, okay. I was like, okay, I'm just regular. This is okay. And a lot of people have this problem because at first I was embarrassed. I was ashamed. I was like, how could I be depressed and suicidal? I mean, you know what people go through, and me coming from a Black community, I got a good job. I got good money. I am healthy. My kids are healthy. I felt like I had no right, but we all have a right to feel whatever it is we're feeling. Every one of us, no matter what you come from. And so that taught me that. And that's why I speak about it now. That's why I'm such a staunch advocate for it. But that bill was meant for people like me because I found out as I've been speaking over this last year that a lot of doctors feel that way. And a lot of us doctors are ashamed because we're doctors. So I say to you, any doctor out there, any nurse practitioner, any nurse, because they have the same problems, get over yourself. Mm-hmm. You are like all of us. And so many people, probably more than you, feel that way. Anytime the statistics say somewhere around 60% of doctors are burnt out, and then something like 40% of us left the healthcare workforce after the pandemic, you're not tripping. You feel what you feel and you're right. So that bill has been passed and hospitals are supposed to have services to help you when you are having burnout and depression and it's supposed to prevent suicidality because that number is high. That's one person per day.
Yes.
One person per day. And so by some statistics I've read, that profession has the highest rate of suicide. And we're supposed to be the people healing people. All right. So the hospital is supposed to take care of you. And the hospital has notoriously not done that. They actually notoriously have done harm, meaning trying to get you to work more than you need to work. Other professions that coincide with what we do are paramedics, like a paramedic or a policeman. I remember a specific call where I saw a patient that they had a horrible accident where they were near decapitated. And when that happened, the paramedic who brought them in, I didn't see them for a while. And I was like, what happened to so-and-so? Well, they had to stay off of mandatory therapy. I didn't get therapy. And that's what we mean, trying to take care of us better. making sure we're stop the trope that we're superhuman and get us the help we need because we go through a lot. Think about our job versus other jobs. And I'm not saying that other jobs don't have injury from a psychological standpoint, but when you lose a patient, you internalize that, especially depending on what kind of patient. Like one of the worst ones, I lost a child patient. And you wonder, did I mess up? Was it my fault? Could I have saved that baby? What could I have done? And this is all of us. I talked to one of my best friends who had slowed down quite a bit. And I never knew, but she was like, oh, I've had so much trauma. She's like, the one time that I lost the one patient and we were talking, it was a teen. And she was like, I keep thinking about that. I think a lot about this mother I lost. She was a mother and she had children around my age. And her husband was a big old guy. And the way he buckled when I told him that despite our best efforts, we couldn't save her. Those things stick. We need to take care of our mental health.
Right, right. So you said a lot about representation, and I'm a huge advocate on representation matters. So as a African American, as a woman, as a physician, and also as a person who has been diagnosed with autism, how do you just exist and not, I guess, over extend yourself to being that person that always has to represent every category?
I don't have to represent. I feel like I get to represent.
Okay.
All right. And I'm going to represent every time I show up as my authentic self and not try to fit into any box, because the way I am and how I am, being a female, being Black, being on the spectrum, having ADHD, any of those things that you think stereotypically were a negative, they're actually quite beneficial. Because here's the deal. Let me run down how it's beneficial. So I'm in Missouri and I work a lot in one of the rural hospitals. Not a lot because I don't work a lot anymore, but I work in one of the rural hospitals. Here's how representation matters. So a patient comes in and let's say there's not too many Black people in this area. In particular, I remember a case where this Black little girl came in and one of the physician assistants were seeing this patient and she had some hair loss around in her hair. And the nurse practitioner, the physician assistant was like, okay, we can treat this with some creams. And I was like, no, we can't. Because in hair, when there's tinea capitis, which is an antifungal, especially in African American, you have to treat it orally or else she will continue to lose hair. And just, you're supposed to know that different groups, different treatments.
Yes.
One size does not fit all. That's how representation matters. Then you go female. I remember a time where a colleague handed off a female patient to me. And this female patient, he says, oh, she just got some belly pain. I'll work her up. She was a woman in the 50s, 60s, like late 50s, early 60s. And he's like, work her up. She's almost done. You can finish it up because I'm coming on shift. He's going off. And I was like, well, did you do some cardiac testing? He's like, no, she's got belly pain. I said, well, women have heart attacks differently than men. It can present as nausea. Representation, thinking about the things that happen in other groups that's not typical. Most of our research has been done on white men, but it takes someone to really think about how does this apply in a different way towards another group. And then we go with patients who may be on the spectrum. I'm very sensitive to that. And I'm able to know that I don't come directly at you. I ask if I can touch you. I keep the noises down. And I have a rapport so that we can do the exam versus many physicians will be frustrated, like, oh, I can't do this, maybe sedate them. I'm like, let's try something else. And lastly, being on the spectrum and having ADHD, it works perfectly for the ER. Here's why. I'm very sensitive to lights and sounds and all the things. You think, well, then how can you work in the ER? Because my mind works like this. I'm able to hyper focus on what matters. And so while something is going down in this emergency, some people in the room, some staff may be freaking out like, oh my God, what are we going to do? I am not. It's a blessing that my emotions are blunted in that situation because at that time I'm calculating, oh, he's bleeding, but it seems like it's not that brisk. And so we have a little bit of time. What I can do is that's probably coming from I'm naming the arteries and thinking of ways in which I can make that stop and save his life. And I'm very calm about it. because my emotions are not the same as everyone else's. And that's how being on the spectrum is protective in that situation and an asset. So I show up how I am, and I'm not embarrassed about any of it at this juncture.
One of my favorite shows is The Good Doctor. So it's just always so fascinating to see how his mind works. So that's just pretty exciting for me. And I work with a lot of people that have autism or Asperger's that are on the spectrum. And I always try to speak positivity into their life and tell them all the things that they can do or be. So thank you for representing that group.
Mhm.
What's one health truth or myth that you wish more people knew?
You know what? Right now, I think more than any other time since I've been a doctor, people need to focus on how do I stay well. We've
Mhm,
been so dependent on this pill, this potion, even supplements. But go back to the time where our ancestors, especially Black ancestors, didn't have access to healthcare. What did they do?
mhm,
They made they made food their medicine. And so what I wish more people knew is processed foods are really, really, I don't want to be dramatic, but killing us. Processed foods became really in vogue in the 80s. And this was because there's no coincidence that the tobacco industry was losing money because there were warning labels on the tobacco. And so you even have some tobacco companies that bought food companies. And so now your food is addictive, the
mhm,
processed foods. And so I try to steer clear of processed foods as much as I can. And I try to eat food that I eat meat, so foods that were just killed or foods that came out of the ground. If you
mhm,
think like that, a lot of your health problems will resolve. There are countries that have very little diabetes because they eat mainly foods that are not processed. There are places that have very little hypertension for those reasons. And I think that's probably the biggest health message I can spread. And number two, I gotta say it. Vaccines, we have already done this. We don't need to go backwards. For the most part, and I know there's a big distrust in the Black community. For the most part, you need your vaccines. I will be the first to admit there's some vaccines where I'm like, do you really need that? But there's majors that you need, like your polio, your tetanus, and diphtheria, whooping cough. Those are diseases we got nothing for. There's plenty of diseases that most of these viruses we got nothing for. So that if you get them and you come to the ER, I can't do nothing but thoughts and prayers and hold your hand. We got nothing.
right.
And that's why those vaccines exist. So I gave you two facts. I know, but I had to put that out there.
No, that's wonderful. Thank you so much. Thank you so much for coming on to the show. And you've been a wealth of knowledge, and we appreciate you so much.
Thank you for having me. And anyone who wants to follow me or read my newsletter, just text the word strong to 55444.
And how can people find you on social media?
I'm most active on LinkedIn, just under Pamela Buchanan. And again, if you text that strong to 55444, then you'll be on my newsletter and you'll be in contact with me.
Awesome. Thank you so much.
Thank you.